Do you suffer from low back problems? Sciatica, sacroiliac, lumbago, pain in the butt syndrome, whatever? Well, too many people do. The healthcare statisticians tell us that it's epidemic. Well, you can go to the chiropractor who will crack your bones, and you can go to massage therapists who will mash on your muscles. You can go to physical therapists who will try to make you a lot stronger. Or to an osteopath who will probably charge you a lot of money, although they'll do a very good job. Well, any of those professionals, if they're honest, will tell you that they can only do so much and that you really need to do something for yourself. You need a home remedy. So what kind of home remedies are there for your low back? I'll bet you've never considered belly dancing, but this is the type of movement that can solve the problem for you. First, what is the initial problem? What is the problem of low back pain? If I had to pick one word, I would say constriction. The muscles are tight. The tight muscles compromise the blood flow, the lymphatic flow, the nerve signals, the energy grid, and the solution, therefore, is to loosen things up and make them pliable and flexible. And this sort of movement is the kind of thing that can help. Now, I'm going to illustrate with this extra spine, not to be a replacement for the original. There are three main muscle groups that support your low back. In the back, you have ones that run vertically up and down the spine and hold the spine erect from the back, and they are called the erector spinae. Then you have ones on the side, which are almost vertical, but run at a bit of an angle, like the base of a tree trunk. And there are four of them, and they're called the quadratus lumborum, two on the left, two on the right. And then in the front, the ones that are buried deep inside your guts, and you can't really get to them unless you're a very skinny person, they start at the last rib and come down the front of the spine and on the inside of the pelvis, and then they wrap around and attach to the top of the leg. And what they do is fold the body in half. So if you're lying down, it would be picking up the upper body or picking up the lower body. And often these ones in the front are, if there's a problem there, if they're tight, it will be evidenced as an issue in the back. And you'll think it's something back here, but really these are the ones in the front you need to address. So to make them flexible and pliable, the simplest way to think of it is stretch the back, stretch the front. Stretch to the left, stretch to the right. Left and right, back and front. And circles. This is a little clunky, but I'll show you in a live human myself. But let me just show you those in a book before we do that. This is Netter's, the new standard after Grey's Anatomy, before Grey's Anatomy was a TV show or whatever it is. So here is the view of these muscles with everything else cut away. Right here you have the quadratus lumborum. You can see there's one that's closer to the middle and the other one closer to the outside. And they run from the top of the hip bones up to the bottom ribs and attach to the lower spine as well. And then the longer ones that run up and down the spine are called the erector spinae. And then the ones in the front, the iliopsoas, I think you can see here. So last rib coming down the front side of the spine, lining the inside of the pelvis, and wrapping around to the top of the leg bone. So that's the iliopsoas. So to get those three sets flexible and pliable, You sit comfortably, somewhat poised, vertical spine, not stiff, but a little bit, you take the slack out. And then you slouch backward to stretch the ones in the back, come back up to vertical and keep going. Stomach goes forward, gets the ones in the front. Backwards and forwards. And you would do this for a minute or two, several repetitions. Maybe more if you feel like you need it. What you don't want to do is to go to your full limit. And the reason is that as you get to the full limit, the nerves will sense a risk of injury, and they will automatically tighten up the muscles, and you cannot override it. And since you're looking for loose muscles, you'll be working against yourself. So just be aware you don't go to your full limit. Generally 70-80% is about the right amount to do. Over time, your 100% will increase. But don't try to make it happen too soon because it'll be counterproductive. So that's the front and the back. Now side to side, easiest way, just shift the torso over the pelvis. And here your back is, if you look at it from the side, it's relatively vertical. Just shift side to side. Now if you want to combine those, this is where it looks a little bit like the belly dancing. So back, side, front, other side. And you make a circle. So the circle is the torso over the pelvis, clockwise, counterclockwise. And again, stay within a nice, comfortable range. Now, I'm making it very large so that you can see, and it'll be obvious, but you could make it so small that it's barely noticeable. And you would do this, sometimes this is much more effective because you're getting the micro tensions that would otherwise be overlooked by these large, gross movements. And this is, shall we say, more discreet. And because of that, you could do this on an airplane or on a bus, in a car, on a long trip, and keeping your low back flexible. You may not want people to know or notice what you're doing. They're probably not going to ask you anyway, but if they do, you can tell them, I'm just staying flexible here. So this is one of the things I do on a long trip. You can do this in different positions. You can do it on all fours. So your back goes up like a camel and down like a horse, side to side, circles. I'm not going to do it standing because it's just going to look silly, but you can imagine belly dancing. If you're in pain and can't get out of bed, the best position is to lie on your back, have your knees up, and do it this way. So forward, back, left, right, circles. And this can be a lifesaver. It's saved me once or twice when I just did something horrible to my back and could not get out of bed, and stayed in bed most of the day just working it with this circling business, and finally got it all worked out. And had I not known this, I probably would have been down for a week, but instead just a day. So that alone, that circling routine, combining left and right and forward and backward, that can do wonders for your back, and that may be all you need on a daily basis. But if you need more, there are some wonderful osteopathic techniques. And I've been in the field of massage therapy and what we call manual medicine for a long time now. And only in recent years have I come across these really great techniques from osteopathy. And there are people who are running around teaching these things in weekend workshops, and I'm immensely grateful because that means I don't have to go to med school to find them out. And so what they are, there's two techniques I'm going to show you for the three muscle groups. So for the ones in the back first, you can sit comfortably and just do a forward lean. And just lean as far as you begin to feel the least little bit of resistance at maybe about 10 pounds of pressure, or a glitch, or maybe a little bit of pain. And let's say mine, first glitch is right at this angle. So I stay here, and next what I do is I start going back the other way with about 10 or maybe 20% of my effort, not enough to take me upright, and I hold that for about 10 seconds. And after the count of 10, I just let go, and you get another few degrees. And stay here for at least another 10 seconds till the body acclimates, and repeat. So 10, maybe 20% of your effort in the opposite direction for about 10 seconds, then let go and get acclimated to the next level. And you can repeat this 4 or 5 times before you've exhausted what the technique can do. Now, you may choose a different position. You may like to stand and lean over and do the same thing. First glitch, stay there, then start coming back up. 10% of your effort for 10 seconds and let go, and you'll get a few more degrees. Stay there 10 seconds and repeat. You could also, if you like, lie down and put your legs out front and lean this way. So there are a few ways to do that. So that's the ones in the backside. Now the ones on the front, the iliopsoas, the deep ones behind your guts. Easy way to do that. Go down on one knee. I'm going to do the right side. I go on the right knee. And left foot is flat. And I have some support back here with my hands. Or you may want to have a chair or a bed that you're supporting yourself with. And then you just go forward, which stretches this muscle here inside the guts. And stop when you hit the first hint of resistance or pain or glitch or whatever you want to call it. And then you curl the tailbone under and forward. You won't be able to see it, so I have to show you with my hand. And do that with 10 or 20% of your effort for about 10 seconds. And then you let go, and you see, can you get a little further? Relax, get used to it for at least 10 seconds, and you can repeat again 4 or 5 times before you've done what the technique can do. If you can't go down on this knee, I get this a lot. I got knee problems, I can't do that. Well, you can stand. So you start with your legs parallel and put one leg back to where it slowly catches, just starts to catch. And then again, curl under, bringing the leg forward a little bit from the pelvis, from the tailbone. 10% of your energy or so, maybe 20 for 10 seconds, and then let go and see, can you go back further with it. Alright, so that's the iliopsoas. I do these almost every day, even if I don't feel like I need to. I find this one especially helps an awful lot. There's tension that you're just not aware of in there because they're so deep. And I find this a great help. Now the muscles on the sides, different technique. And colloquially, we call this fold and hold. So this is useful if you have a problem on just one side. So let's say I have a problem on my right side. And what I do, little support here with the arm, and I just lean. So I compress that muscle to the side, and I stay here for 1.5 minutes. Now you can fine-tune it by turning the torso a little bit to the right and the left, or by slouching the pelvis, rolling it backwards, rolling it forward, until you feel like that is exactly the right point. How do you know when it's exactly the right point? Well, there are 2 ways. One is where it feels most critical, which could mean the most painful. And that'll work just fine. What I do if I can is find instead the place where it's most comfortable, the least amount of pain, where it feels like right there it stops hurting. And that's where you stay for 90 seconds is what the textbooks say. It may happen sooner. But if it goes for a couple minutes and you're getting no relief, it's not going to work. You do something else. But when it works, and it works well, at about a minute, minute and a half, things will just give way. And you'll relax and just, oh, where did that tension go? It just all dissipated. So I use this one very frequently, maybe not every day, because I don't get a pain on one side every day, although I do quite often because of a very old injury that never fully healed, and it reverberates only to one side. And so frequently I will have to do this fold and hold technique, and it takes care of it for at least the rest of the day. So it's not a permanent cure, but, you know, what's a minute and a half a day? Almost nothing. Together, these techniques, you're only going to spend 10-15 minutes working them. So I try to do them every day. Even if I feel like I don't need to, often I'm very surprised at how well they do actually work. So there we have the two osteopathic techniques. The MET, muscular energy technique, which we used for the front and the back. Again, you stretch to a certain level and then go back the other way with 10% for 10 seconds and let go for another 10. And the fold and hold. Those things will take care of most of your low back problems. Now, I do want to say something else about more serious problems. So there are a surprising number of people who, due to too much heavy lifting at some point in their lives, or perhaps the opposite, too much sitting around, too much sedentary lifestyle, will develop a compression on the low spine. So due to extra weight either being lifted or perhaps weight that you've gained, there's a downward force on the low back. And this downward force can cause these little discs in between the vertebrae to bulge out and sometimes even rupture. And that can cause you all kinds of problems. And they may recommend surgery. Well, a lot of people are suspicious of surgery because maybe it works, maybe it doesn't. Maybe you're better, maybe you're worse. So what can you do to address this bulging disc problem on your own, at home, a home remedy? As you might imagine, the solution to compression is decompression. You want to lengthen the spine. You want to take the pressure off. Now, there are chiropractors who will have special tables that will stretch you, and they use about 60 pounds of pressure to pull you apart, which sounds like a lot to me. Imagine this, though. Theoretically, if you weigh 120 pounds, half of your body weight is above the belt and half below. So theoretically, a 120-pound person could be suspended vertically at the hips, and it would be okay. I would err on the side of caution with this, because you can tear something, even if it's a micro tear, and that'll cause you further problems, and maybe then you'll really need surgery. So I can show you something that will probably work, but you'll have to be a little creative with it. What you can do is rig up a board that you can lie on with your back as flat as possible, and to make that happen, you want the knees to be up. You can see these amputated legs here, but you can imagine they're knees eventually. And then you want to have a belt that fixes you at the hip bones. And then you'll need somebody else to tilt the board for you. And I would start with about a 10-degree tilt, just to be on the conservative side. And you could stay in this position for 5, 10, 15 minutes. A lot of gymnasiums have a slant board where you're supposed to do push-up or sit-ups on. That could work. This bench I'm sitting on, that could work. Or if you live near a playground, a seesaw might work. But anyway, the idea is to let the weight of the upper body pull out of the low spine. And if you do this and all goes well, these bulging discs can actually go back in and repair themselves. And I would do this kind of thing on a daily basis if I had that problem. That's one of the things I would do. So there are solutions to bulging discs that you can do at home. And the last thing I want to talk about is the guts. Now, a low back problem could be caused by a tension or some other issue in your organs. All of the organs are attached to the spine through a three-dimensional network of sheeting, which we call the omentum, the greater omentum, lesser omentum. And if you have a tension or some kind of problem, that can cause low back pain. There are people who can help you with it, who can manipulate the viscera. We call it visceral manipulation. Certainly osteopaths know, sometimes chiropractors know, sometimes massage therapists know. If you've taken the courses, you often know what to do with these things. So I'm just going to leave you with my favorite story on this, and it's from the textbook by Jean-Pierre Barral, the French guy who really wrote the textbooks on visceral manipulation, and this one's from the pelvic one. So the story goes, a woman comes in with chronic low back pain, and they check her out and they say, well, your muscles are fine, no tension there, and your bones are in the correct alignment, no problem there. We think the problem is the uterus. It's tilted too far forward, I think it was, causing a strain on the low back. So they have to go internally to fix it, which they do. And her low back problem is alleviated. Fine. So she goes home. Well, a couple months later, they get a phone call from the husband. What did you do to my wife? She's pregnant. This was an unintended side effect of the treatment. The uterus was bent so far that the sperm could not pass into it. And when they alleviated the back problem, they alleviated her infertility problem as well. And maybe she didn't even know she had that issue. So that's the sort of thing that could possibly be related. I think there's a moral to that story somewhere, but I don't know what it would be. Anyway, the organs can affect the back. So there we have a lot of material. If you have low back issues, start at the beginning with the circling, then go to the osteopathic techniques after that. And this will take care of most of your problems. You can write to me if you have other questions about it, and I'll see what I can do. But good luck with it, and thanks for your time.